Tendon ruptures around the shoulder. Rotator cuff tendons. Here you can see the supraspinatus rotator cuff tendon. The infraspinatus rotator cuff tendon. The teres minor rotator cuff tendon. The biceps tendon. The subscapularis tendon. And the pectoralis major tendon. The supraspinatus tendon is the most common of the rotator cuff tendons to be ruptured. Tears of the rotator cuff tendons are common shoulder injuries occurring in overhead throwing sports. How do you examine for rotator cuff tears? The Jobe test is one way to test for rotator cuff tears. The patient should either be standing or sitting upright. The arm should be anteriorly flexed at the level of the shoulder. Fully pronate the arm into the empty can position. The patient should resist the downward force being applied by the examiner. Pain or weakness indicates a supraspinatus tendon lesion. Infraspinatus tendon rupture. The infraspinatus attaches to the back of the greater tubercle of the humerus at the posterior upper arm and can easily strain or tear. Weakness of abduction and external rotation of the shoulder often is a sign of an infraspinatus tear. Rupture may also include the tendon of the teres minor. Subscapularis tendon rupture. With complete rupture of the subscapularis tendon, the transverse humeral ligament will become torn, causing a medial dislocation of the biceps tendon from its groove. How do you examine for subscapularis tendon tears? The lift-off test is often used to diagnose the subscapularis tendon tears. The patient places the hand behind the back at the lumbar level. If the patient can lift their hand away from their back, this is a sign of an intact subscapularis tendon. If the patient is unable to lift the hand away from the lower back, then a tear of the subscapularis tendon is suspected. Biceps tendon rupture. Rupture of the proximal biceps tendon is most often found in association with a rotator cuff tear. Rupture involving the long head of the biceps tendon usually results in a Popeye muscle bulge. Pectoralis major tendon rupture. The patient will experience pain while extending the arm. Ecchymosis is present down the arm. The pain is worsened with resisted adduction and extension. There will also be a loss of normal contour of the axillary fold.
I just tore something in my shoulder. Hello, Doc. That last pitch was a good one, but I'm afraid that I messed up my shoulder. It's time that I left the game. Can I come see you?
Come right away. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.